COVID-19. COVID-19 is a disease which has made all over the world people health conscious. Earlier, people were not so much health conscious. Nowadays, everyone is health conscious. So we have to take care of all the healthcare, because COVID has got various ramifications. It is not just a lung infection and just like a flu and all. It started with that, but gradually we learned so many dimensions, pathological dimensions, and still it is emerging. Still the danger of COVID fourth wave is looming, and in Europe and all, China, it is very active. And our government, under the leadership of central leadership, we are able to confront very effectively as far as we see the casualties, we see the epidemiology, all those things. We have a better score than the developed Western counterparts. So with this, the vaccines were produced in India for the first time, and we became the vaccinator of the world. I can tell you, because we produced at a cost-effective manner, and our vaccines are really effective. That's why we are all alive today. Otherwise, we would have had a serious COVID-19 this thing. So not only the COVID-19, the health awareness, which was missing in our country. Health awareness, which was missing in our country, came into prominence. People realized the importance of health. So many people started exercising, doing pranayama, doing yoga, all those things started in the country. So with this brief reports, I wish you all the success for the conference, and be alert. And we are all the pharmacists. We have our own responsibility to protect the people from the ills of diseases and drugs. I mentioned here diseases and drugs, ills are there. So we have to maintain that. Let us focus our attention and do a more professional activity, and lifetime mission of the conference be, not only conference, the association be the pharmaceutical care everywhere. Thank you very much. And I thank the organizers for giving me such an opportunity. And let us see the whole day how the conference will move on. Thank you very much. I close my remarks here.
Thank you, sir. It was wonderful. Now I request Professor N. Udupa, Executive Director.
So, good afternoon, everyone. So, I welcome all the South Zone, this South India or ACPI Association, led by with the leadership of Dr. Ananta Nagappa Nayak, and I compliment Dr. Hanumanta Joshi, our South India Scientific President, and all the office bearers, and particularly today's our speakers, Dr. From Bangalore, and also for Dr. David and Dr. Kapil and others, all the resource persons who are on post-COVID. This is a very good topic. After 3 years, we are having the lot of the pharmacy care. It has to be given. The health care has to be given most important, and we are all seeing that in this post-COVID session, we will be able to see that we will be delivering, particularly the our pharmacists are the custodians of the health. In the healthcare providers, the pharmacist is the custodian of the medicine and drugs, and he is required to manufacture, distribute, and take care of the quality control and the marketing, everything. He knows everything about the medicine and drugs. So we we are playing a very important role for the healthcare, and particularly during we are the real COVID warriors. So many pharmacists and the control department and all we have provided even for manufacturing of the vaccines, distribution of the vaccines from India. Pharmacy and pharmaceutical industry has contributed a lot for the COVID, and almost in India, everyone is so far. In the other countries also, we have exported for Indian made manufactured vaccines, and we have given new technologies, and we made it affordable with the less cost and almost free. More than 90% of our population, or including children, were with the booster dose. We have now remaining people also will be within a few months. Everyone will be, and we are even for fourth wave or fifth wave, whatever it is, will be able to face. And even the medicines and drugs are required for even future also. With new development, even the traditional medicine, we have to increase the immunity, and any other disease also, infection disease or whatever diseases, for polio, malaria control and all, and also for the environment, and also we have to play with the green chemistry. We have to see that environment friendly methods, synthesis and all. We have to see that affordable medicine should be available with innovative ideas, innovative injectables, and other alternate drug delivery and all. Hospital and clinical pharmacy is very vital, because many of the for the community also, the hospital and clinical pharmacists are going to help a lot. And let us take the responsibility. And this is a very good session. Very good speakers are identified, and our South Zone will definitely prosper, and all the participants, more than say 500 to 1,000 people who are attending either physically or virtually will be get benefited, and they will take away a message. And I think the proceedings will be made available, and I request all of you to contribute to our Indian General Hospital Pharmacy. A new editorial board is reconstituted. Many of you will be the active members, and our editorial board members, and I require many of your contributions and articles and papers and research papers, and let us strengthen this journal also, and community that hospital pharmacy journal also. So with this, once again, I wish all of you all the best, and I and also appreciate the leadership of this particular association for uplifting through webinar and other activities this particular message. So wish you all the best. Thank you very much for giving me an opportunity to participate, actually participate, and interact with all of you. Thank you very much. Good day.
Thank you, sir.
Thank you, sir. Thank you.
Now I request Dr. K.S.G. Arul Kumar, Secretary, ACPI South President, ACPI Kerala Branch, to introduce the speaker. Please, sir.
Arul sir, are you there?
Sir, I am facing some technical issue.
Okay.
Can you wait for 2 minutes? That the
Yeah, why not?
internet.
Fine, no problem. Meanwhile, thanks to the good words by Dr. Udupa sir, we will definitely work with you, sir, for the development of the profession. We just heard your guidance, which you have been giving since beginning. We will be part of that journal also. And even I request Dr. Vijay Kumar and my other friends also to start contributing. We can definitely support it.
Am I audible,
Sure.
sir? Dr. Joshi, sir?
Yes, sir, you are.
No, it's audible.
Then no problem. I can use my mobile, sir, now.
Fine, yes.
Let it be.
Yeah.
I'm ready.
Go ahead, sir.
Hello?
Arul sir, go ahead, please.
Yeah, at the very outset, I would like to thank man of Mysuru, Dr. Joshi and his team for giving this great opportunity to read today's Ruby Raphel biodata. Truly speaking, I'm very happy to read Dr. Ruby's biodata, and her biodata is like a Hanuman tale and very difficult for me to cut short into a single page. It is such a heavy biodata, and her biodata goes like this. Dr. Ruby Raphel has rich experience in clinical research, pharmacovigilance, pharmacotherapeutics, and has subspecialist interest in casualty assessment of ADRs. She completed her MBBS from Universal College of Medical Sciences, Tribhuvan University, Kathmandu, Nepal in the year 2003 to 2009. MD Pharmacology from Pushpagiri Institute of Medical Sciences and Research Center, Trivalla, Kerala.
हेलो मैडम तुम सोना बोल रहे हो
In the year 2015 to 2018, and she has also obtained a DM in clinical pharmacology from Nizam's Institute of Medical Sciences, Hyderabad in the year 2018 to 2021. In addition, she has been enacted as a co-investigator for phase 1, 2, and 3 Covaxin clinical trials, Nizam Institute of Medical Sciences, Hyderabad. Also served as a short-term consultant for an international network, React Asia Pacific, working on antibiotic resistance. I am pleased to inform you that Dr. Ruby has been awarded Best Research Paper entitled A Prospective Double-Blind Placebo-Controlled Parallel Group Study to Evaluate the Effect of Cardiorium Plus on Vascular Endothelial Function and on Biomarkers of Inflammation, Oxidative Stress, and Insulin Sensitivity in subjects with vascular endothelial dysfunction in one-day virtual conference held on 8th September 2020, organized by Amrita Institute of Medical Sciences, Cochin, Kerala. And she's a registered medical practitioner and life member of Indian Pharmacology Society and the Medical Association, IMA. With this brief introduction, I am request ma'am to proceed her session. Ma'am, over to you.
Thank you, sir. That was-
Original opening forms, Allah.
Ma'am,
thank-
please.
Okay. Thank you, sir, for the elaborate introduction, actually, I would say. Thank you, ACPI and Dr. Gampa, sir, for inviting me for this session. And without much delay, I think we are already half an hour delay. So I'll start my session. So I'll share the screen now. I hope my slides are visible. Everything is fine.
Yes.
No? Okay.
Yes.
So the theme of this today's session is mainly COVID, post-COVID sequelae. That is the post-COVID complications. I understand most of the participants here are students, so I'll be talking in very in a language where they can understand. So yeah. So the overview of my presentation is this, like I'll be talking about the definition and then the post-COVID sequelae in these major systems. So coming to the pre-COVID and post-COVID. So I have actually in the slide put many memes. Actually, these are a few memes that I found it very interesting. So you can see many memes saying that, the pre-COVID condition was very clear. You can see in this meme, it was fine. But in this post-COVID situation, you can see many holes and it's totally damaged. And you can see in this meme where, it was a frog which was lean, it became fat, okay, in 1 year. And you can see in this meme, earlier it was only one person who was working at the computer. Now you can see many people at the same time working on the computer. And earlier, they were worried about the investments in Bitcoins and all that. Now we are worried about mask. We should have bought mask. We should have had mask and all that. So there was a lot of changes that happened from pre-COVID to post-COVID. Okay, so there was a socio-economic impact as well as there is a health impact. So I would like to focus on the health impact. So what do you mean by a post-COVID or a long COVID? As you all know that acute COVID is defined as the signs and symptoms of COVID up to 4 weeks. Whereas in long COVID, it is ongoing symptoms, that is beyond the 4 weeks. So these symptoms are lasting long, and you can see that it can be again divided into two. One is ongoing symptomatic COVID, which is the signs and symptoms of COVID from 4 to 12 weeks, and post-COVID syndrome. Post-COVID syndrome, the symptoms, signs and symptoms that develop during or after the COVID infection, which is continuing more than 12 weeks, that is more than 3 months, and it is not explained by an alternative diagnosis. So we can say that all these symptoms that we are going to see, that is post-COVID, only if it lasts for more than 3 months. So now coming to, first we will see that what does that cost, our heart, like what was the post-COVID complications that happened in cardiovascular area. Okay, so these are few celebrities which already know. Can anyone unmute and tell me the name of this famous personality? Any students? Hello? So none of the students are listening, or, I assume that all are sleeping. Hello? Hello, am I audible?
Yes, ma'am.
So anyone can identify this famous personality? No? No one? He was a Big Boss winner maybe 2 years back. Nobody wants to answer, or nobody wants to say. So this is actor Siddharth Shukla, who died due to a sudden cardiac arrest at age of 40 years. And anyone can identify this actor?
Puneet Rajkumar, sir.
Yeah, finally. So at least someone can identify. So this is commonly called Elias Appu, sir, right? So he died at the age of 46 years with the sudden heart attack. Okay. So now I don't think anyone will be able to identify this person. So I'll tell you, this is Shabi Singh, who is a Malaysian football player. He is retired and he is 61 years. He also died of heart attack, sudden heart attack recently. So all these three, why I put the pictures of these three personalities, celebrities, because they all were physically fit. In spite of that, they had a sudden cardiac arrest. Why it happened? So there is a lot of ambiguities regarding why exactly this happened, but there is a common factor, that is COVID. So all these people had a COVID infection prior to their death. So this could be, we can only assume this could be due to a post-COVID sequelae. So the post-COVID, around in cardiovascular sequelae, 20 to 30% of the hospitalized patients with severe COVID had cardiovascular complications. So what could be the mechanism that resulted in the sudden cardiac arrest? So the proposed mechanisms are, like, there was a direct cardiomyocyte damage, means the cardiac cells are getting damaged, or during severe COVID, there was a lot of hypoxia, means there was a decrease in the saturation. So that would have resulted in damage of cells in the heart. Or there might be a small vessels, micro vessels, we call microvascular vessels, that is supplying to the heart, that could have led to damage due to some inflammatory changes during COVID, and some clots that has happened, thrombosis, or a cytokine storm, which means that there were some cytokines, a lot of cytokine release, which would have damaged the heart. So the major initiator of this inflammatory process was mainly in the myocardium. Okay, so this was seen as the evidence of this myocardial involvement was seen as elevated troponin levels, means there was high tropi or trop T, which is also indicated that you are having a heart attack, okay, myocardial infarction. or it could be a venous thromboembolism. It appeared as a heart failure, sudden heart failure, or arrhythmias, abnormal rhythms of the heart. So this all shows that there was a myocardial involvement. So what are the long-term sequelae in this? So the long-term sequelae of cardiovascular is mainly the increase in the cardiometabolic demands, and this also led to a lot of fibrosis in the muscle, that is a myocardium, and also in the scars, which can also lead to arrhythmias. And there is also the heart. There is a left ventricle, there is right ventricle, left ventricle. There are 4 chambers. So mainly it led to the dysfunction of the left ventricle because of this thrombosis and all, and finally leading to heart failure, and also arrhythmias, that is palpitations and abnormal rhythms basically. So all these are long-term sequelae of the cardiovascular complication. Okay, so this is few do's and don'ts, what you should be doing, and what you should not be doing. So when you have where you already have some palpitation, or you already have some breathlessness, so what you should do is you should not do a heavy physical exercise. So as I mentioned before, that the celebrity, the actor Puneeth Rajkumar, he died while doing a heavy exercise. So it is advised that after COVID infection, after you should give adequate time, as in 1 week or 2 weeks, to resume your physical activity. Or if you have certain symptoms like breathlessness, or you have fatigue, then you should do activities which is only 60% of the maximum of your heart rate. So for any individual, the maximum heart rate is always calculated as 220 minus your age in years. Suppose if that person's age is 20 years, and so how do you calculate the maximum heart rate? The maximum heart rate, it will be 220 minus 20. So it would be, the maximum heart rate should go up to only 200. Okay. So, but you should achieve only 60% of that 200 when you have certain persistent symptoms. Okay. Especially when you have had COVID, then diabetes, always you should take care of your heart, cardiovascular health more. Okay. And if you're athlete, then you should avoid the exercise, heavy cardiovascular exercises for at least 3 months. So these are the few precautions that you could take if you have some symptoms, or you are just recovering from post-COVID. So in this is a systematic review of systematic review done by Groff et al., where they have shown short-term and long-term rates of post-acute sequelae of SARS-CoV infection. Here you can see they have enumerated various cardiac disorders, digestive disorders, skin disorders, ENT disorders, etc. In this, you can see that here palpitation and chest pain were the most common ones they have detected. This PASC is nothing but post-acute sequelae of COVID infection. Okay, that is what they commonly term it as. Sorry. So now coming to, so that was a cardiovascular complications. Now, next is the respiratory sequelae, the respiratory complications. So you know that this during COVID, it was the lungs that was primarily affected. Okay, and you know that there is a this entry of this COVID virus was mainly through ACE2 receptors, which was present in all these organs like respiratory, GI. So this all promoted the direct entry, and it affected the organs immediately. So here the high risk group people, like they were more prone for this post-COVID pulmonary sequelae, like those who are above 60 years, smokers, comorbid conditions like diabetes, hypertension, and also those who had already a pre-existing respiratory diseases like asthma, COPD, and those who already required oxygen therapy, and those who required mechanical ventilation or non-invasive ventilation during COVID. All these people had high chance for respiratory sequelae, means lung complications. This is again the same study where they have shown the respiratory disorders, that is the after post-COVID. In this, most common one is you can say the lung fibrosis, and also the cough.
Everyone is agreeing for alternate days, ma'am. We are not telling college, we are telling hospital alternate days is okay. That only we told we will study what we collected at home.
Okay, so so the lung fibrosis, the cough, and dyspnea. So these are all seen during as a post-COVID sequelae. Okay, so these were the post-COVID. So how to increase your so what are the do's and don'ts when you have a respiratory disorders? Obviously, first you have to get diagnosed. You have to see whether there is a lung fibrosis that has already happened. Most of the patients have already underlying some inflammation, and already there is some kind of a damage that has happened to them. So those who have dyspnea, it shows that they have already fibrosis that is already set in, but you can diagnose this only by a HRCT. So what are the measures that you can, there are drugs for preventing fibrosis. So maybe if you already have a saturation fall, dyspnea and all that persisting symptoms, then you should get evaluated, and so that you can be put on those anti-fibrotic drugs, so that you can get a relief from these symptoms, and also you can prevent the progression of this fibrosis. Okay, so that is another that is respiratory. Now coming to the post-COVID GI sequelae, that is gastrointestinal sequelae. Even the gastrointestinal GI, it had ACE2 inhibitors, ACE2 receptors, where the COVID virus came and attached, and it created a lot of symptoms. Okay, so here COVID, we can see GI symptoms, we can divide into three. One is the COVID-induced new onset GI symptoms. And next is the persistence or aggravation of pre-existing GI symptoms, or the drug-induced GI symptoms. So this is a way we can classify this GI symptoms. So what is the difference between a COVID-induced and a drug-induced liver injury? So if you see a COVID-19 induced liver injury, you can see that all these parameters, they might be like this AST, that is otherwise called SGOT. SGOT might be more than SGPT. So here SGPT will be more if it is drug induced and compared to SGOT. ALP, alkaline phosphatase, and serum bilirubin might be normal, or it might be raised, or it might initially appear as normal. Gradually it might get elevated, but it might be elevated when it is a drug induced. Then when these enzymes, if it is elevated more than 5 times the upper lower limit, you can say that it is drug induced. If it is less than 5 times, you can say it is COVID induced. So always there will be a temporal association with the drug if it is a drug induced, whereas COVID induced, there won't be a temporal relationship with the drug. So that is one way you can figure out whether it is a COVID induced or it is a drug induced. Okay, so these are the various ways we can see whether it is drug induced, or differentiate these two. So these were the main drugs that were used during COVID time. So like azithromycin, even though hydroxychloroquine, lopinavir, and antivirals remdesivir, then favipiravir and tocilizumab. So all these drugs had GI side effects. So we need to rule out whether it is a drug induced, but it was a drug induced during that COVID time only. But it will resolve if it is a drug induced once that offending drug, or if you find that if you remove that drug, then these parameters, these enzymes will come back to normal. But in this COVID induced, it is staying for a long time, more than the drug induced. It might stay for a long time. So that is why we need further evaluation here. So there are few do's and don'ts where if you have already there is a GI problem. So these are the few do's and don'ts when it comes to that. So there is nothing in particular where I have to mention, but these are all things that you have already done, I guess. So next is post-COVID nephrological sequelae. So how do you think that kidney was affected here? So kidney was also affected, and many people who didn't have hypertension, they developed hypertension all of a sudden. And those who had CKD, or they already were kidney patients, they had a rapid deterioration, or they had sudden new onset of acute kidney injury in a patient who already had a transplant, or in a native kidney patients, or in CKD patients. They already have CKD, chronic kidney disease, but then they progressed to a end stage kidney disease. So that is one complication that had happened. And also glomerular diseases. So there were new onset of glomerular diseases, which were presented as proteinuria, hematuria, or renal dysfunction. So this were few nephrological sequelae after COVID. So in this, first you have to identify these symptoms. So these patients might be having already, hypertension. They may not be having hypertension, but they all of a sudden developed hypertension and fatigue, or they had a more of frothing in the urine. They are having swelling in the leg, or they're having breathing difficulty while lying down. They have a problem, and they might require more antihypertensives. So all these, there was all these things happened, but they might have these are the symptoms that they could have had, but there was few signs indicating that yes, they were going into some kidney problem. So they might be having tachycardia, means increase in the heart rate, tachypnea, more of respiratory rate, tachypnea, or new hypertension developed, or worsening of the existing hypertension. They were having less hemoglobin, that is anemia, facial puffiness, pedal edema. So these were the few signs that could indicate that yes, these patients are having kidney problems. So you can run a lot of if you tests to see that whether these patients are having any impending kidney problems. So you can run a serum creatinine, blood urea, urine protein. So these are the ways that we have to investigate, the clinician will do. But if you have these signs or symptoms, then you should not delay. You should immediately visit the visit the clinician. So what are the do's and don'ts? Yes, there are a lot of do's and don'ts which we already know, but here this taking good care of your diet, reducing stress, and always try to eat home cooked meals, all this. And also when you think that okay, you're going into some kidney problems, you need to restrict salt. So all these and also water should be restricted if you are going into a kidney problem. So all these things have to be taken care of. Okay. And next is the post-COVID sequelae of neurological complications. So as we know, it had a lot of impact on the mental health. Mental health is one thing that many people silently suffer, especially when it comes to depression. So all were locked up in a room. They were in quarantine. It was weeks and weeks of quarantine, work from home. Children, they cannot go out to play. You have a lot of the social life is being hampered. And also you are in a total isolation when you have a COVID infection. As such, many people, you are isolated as and you don't even if you are hospitalized, you don't find your relatives or your husband, wife, children, nobody near you. You have only a treating nurse or a doctor who will be visiting you on and off, and then doing video calls and all those. But so these are the few mental stresses, or you can say that there was psychologically a lot of effect. And but there was other problems that we can say that is neurological. That is, if you had, they people have now changes in the concentration, impaired memory, persistent weakness, and myalgias, headaches. There are sleep disorders. And also another one problem is the nerve involvement, I would say, is because of loss of smell. Yes, the anosmia, and also the taste, ageusia. So I'm also a person who had COVID. I got COVID when during the month of October. But I still feel that, okay, I still can't appreciate the smell, the perfumes. I don't think I can still appreciate that. So this is one of the long COVID problem, the complications, which will take a long time to resolve. But you don't have to get panicked. It will get if there is a nerve involvement or inflammation of the nerves, but we don't know. There are no studies. We don't know when it will resolve. The median time of resolving the loss of smell, they say that it is only the studies have shown it is 30 days. So but for some people it is going for more than 6 months. So it all, this is all new disease, so we don't know how long it can take also. So there is a problem, but you don't have to get panic, but you have to get evaluated at the same time. So because of this facial nerve involvement, all these problems have happened. And also some people had stroke, and some demyelinating polyneuritis, autonomic dysfunctions, like when you stand up, like you have hypotension, you have some dizziness. So these are all symptoms that has happened for some people after COVID. So after what could be the pathophysiology behind it? So the pathophysiology that we assume that it might be due to the direct invasion of the central nervous system by the virus, and also by neurodegeneration. And also there was a dysregulated immune reaction and a weak immunogenic response that has happened, which resulted in an incomplete virus eradication, which is resulting in an ongoing inflammation. So some people might be genetically predisposed for certain problems. So these are all etiology. It could be these are the reasons for post COVID sequelae. And also, what are the probable factors which we could predict this long term symptoms? So it could be due to a severe COVID infection which required a hospital admission, or it could be due to old age, more than 60 and all. They might be more prone for COVID, post COVID sequelae, or obesity, or more if they had more than 5 symptoms in first week of acute COVID, they might be having this sequelae. So in this this is yet again, this is a box plot which is showing that in a systematic review which I mentioned earlier, by Groff D et al., where it is showing that there was around 15 to 16% of headaches reported, and the taste disorders, the smell disorder, the cognitive impairment, memory deficits, and difficulty in concentrating. So these are all sequelae, complications of COVID. So mental health disorders, I have said that many people, they silently suffer depression, and also they suffer from sleep disorders. because of COVID, it has resulted a lot of anxiety, and not just mental health in terms of, it might be due to other family issues or job issues, and so many other stresses might be there, which has resulted in these disorders. And also there is a post-traumatic disorder syndrome, where these people already, it's a traumatic situation. The COVID was initially a very traumatizing situation, where you have to go through this, the isolation and everything. So they all had this post-traumatic stress syndrome, which takes few months to recover. So next problem I would say that many people are facing is post-COVID diabetes mellitus. So what could be the reason for this post-COVID? Some people have already been diagnosed for diabetes, but they had worsening of the diabetes because of poor control, as in they were not taking medications properly. But many of these patients, they had COVID, and they were on steroids. So that also resulted in worsening of diabetes mellitus. And some people who were already pre-diabetic, they became diabetic after COVID. And it was a study has shown that, persons who are like, there's a WHO study, they have seen that less than 18 years, those who had COVID are more likely to become they're more likely to be diagnosed as new onset diabetes, more than 30 days after infection. So this could be due to a direct attack of pancreatic cells, which were expressing the angiotensin ACE2 receptors, which was the port of entry for COVID virus. Or might be due to a stress hyperglycemia, which may be resulted due to the cytokine storm, increased release of cytokines and all. Or it could be due to alterations in the glucose metabolism caused by the infection itself. Or the people who were pre-diabetic became diabetic, they were in the verge, or they were more prone to become diabetic. So that could have been the reason. Or this steroid-induced diabetes, which is reversible. So once you remove steroid, the patient would come back to normal with an euglycemic. The patient would become euglycemic. But there are many situations where we have seen patients where they were taking steroids when they were hospitalized, and all of a sudden they think that, because of they have never got evaluated for diabetes, but all of a sudden they are landing into diabetes. So it is because of not just because of steroid, but they were already underdiagnosed, or they were not taking proper health checkups to see to say that they were diabetic. So that is why they landed into diabetes. So there is a registry that is called COVID registry is there, where these people are trying to, it is a international group of leading diabetes researchers who are trying to establish the COVID global registry for COVID-19 related diabetes. You can register there, and you can become a co-author in this. Also, you have to provide information regarding those people who were pre-diabetic became diabetic, so new onset diabetics. So they are trying to find the relation with the COVID, and what are the genetic causes, or what are the associations, various other associations that they could find. So they are trying to maintain this registry and find the reasons. Okay. So there were other general symptoms. Some people had weight gain, but some people had weight loss. But most commonly people complain of myalgia, that is muscle weakness. So for that, muscle weakness is one of the biceps and triceps. These are the major muscles involved, and to get rid of this, you need to see a physiotherapist, or you need to slowly see, you need to see the CKMB levels. So there are a few investigations you have to run. After these investigations, slowly you can get into small exercises where, gradually you have to increase your the gravity of the exercises, as in slowly. You cannot, if you're running on a treadmill, you should start with the minimum, like with the minimum speed, and then you gradually increase, and then you decrease the speed, and then you gradually, so it should be in a graded manner that you should go on with the exercises. So all these muscle strengthening exercises and all these things should be done in a, in a supervised way, and in gradually, not all of a sudden. And aches and pains were one of the, but rather than popping analgesics, which can lead to other complications, you should always get evaluated before popping in pills, as in, like paracetamol and all these painkillers. So many had flu-like symptoms, some had ongoing fever, then aches, arthralgia, joint pains. So these are all common general symptoms that patients were facing after COVID. So nowadays, you can find post-COVID PASC clinics, post-COVID clinics you can find, where there are clinicians who are dedicating their time and energy to, address this issue. So most of the times what we can give is reassurance and to educate them. So we need to educate as a clinical, a pharmacist, what you could do. I think the next speaker, Dr. Gopinath, is going to talk about role of pharmacist regarding this management during COVID. So maybe he'll brief you more regarding your role in post-COVID sequelae. So here, what you could do is educate people, create awareness, and also encourage. If you have relatives, if you come across people, you can tell them if they have if they have some symptoms which you think it could be due to post-COVID complications, you can tell them to go for routine checkup, health checkups, evaluate. And also those who haven't got vaccinated, to tell them to get vaccinated. Always this the incidence of COVID is less in vaccinated people rather than in unvaccinated people. That's what studies have shown. And also the medication reconciliation is one way where, you compare their pre-existing prescription with the new prescriptions. You see there is any duplication of medications, you see any interactions, you see whether these drugs can cause any adverse events. If so all these things can be done by a clinical pharmacist. And also ADR reporting, one of the need of the day, I must say, because most of these conditions, they might be underreported. So you should do ADR reporting very religiously. And the research is very crucial here, because we have seen how the research had a major impact during COVID. Many of these treatments and were new, and this COVID infection as such was new to us. So we had to do a lot of, there were a lot of gray areas where which was difficult in the patient treatment. So the research had played a greater role, and also it has created a lot of confusions also. But then research is very important, and as a clinical pharmacist you can do a lot of observational studies where you can see the prevalence of these post COVID complications. And we need data. We need to know how many are suffering from these complications, how we can address, what are the things, what are the treatment line, how we can come up with a guideline. So all these can be done only through research. So with that, I would like to conclude my session, and I would like to hand over to Dr. Gopinath, who will be enumerating regarding the role of a pharmacist. Once again, thank you, ACPI, for giving me this opportunity. And thank you, Dr. Vijay Kumar. Thank you. if you have any queries or any questions, you can ask.
Thank you, ma'am.
Thank you.
It was a very informative session. Now I request Dr. K.S.G. Arul Kumaran, Secretary, ACPI South President, ACPI Kerala, to introduce our speaker, K.V. Gopinath, sir. Sir, please, sir.
Arun Kumaran sir, are you there? You can proceed, Ranjita.
Okay, sir. Dr. K.V. Gopinathan, he has completed PhD in Clinical Pharmacology, JNTU, Hyderabad, and completed Master of Pharmacy in Department of Pharmacy Practice from Dr. MGR Medical University, India. And he has awarded gold medal and Professor E. Venugopal medal for the best outgoing student. And he is having professional experience in clinical research, teaching and guide experience from 1992 till date. And he has also worked as independent pharmacy and its management since December 2009 in USA. And he also worked as home care management since July 2008 to September 30, 2009 USA. And also he has worked as hospital and clinical pharmacist. And his specialties are glycemic index studies, ADR monitoring, drug interaction, and skilled and extemporaneous preparation of oral and parenteral preparation, CGMP, GLP, OSIS processing, Medicare billing, prescription audit, in-service training for the students and staff, drug information service, and pharmacokinetic studies, and so on. It's great to have you, sir. Kindly take over the session, sir. Please, sir.
Okay, thank you, madam. I audible? Hello, is it audible?
Yes, sir, you are audible.
Oh, okay, give me a minute to share my screen.
Sure, sir.
My slides are visible, madam?
Yes, sir, it is visible. Sir, I think you need to click one more.
Which one? How can I go for this thing, madam? Display of my slides, full screen?
No, sir, it is not visible.
Is it not visible?
Sir, please click on the
Side,
slide.
Gopinath sir?
Sir, is it visible now?
No, it's not visible. Only your computer page is visible,
Is it?
but PPT not visible.
Oh, can you share the PPT, sir, so that I can do that? So just a minute, I will try once again.
Yeah, sure, sir.
Now is it visible, sir? Is it visible? Sir, is it visible, sir? Hello, is there anyone?
No, sir.
Sir, it's not visible. Only your, the folder is visible.
Okay.
Give a moment, we'll share it 1 second.
Oh, okay, please, sir.
Hope it's visible to everyone.
Yes, sir, it is visible.
Yeah, sir, please proceed.
Oh, okay, sir. Thank you so much, sir. Respected dignitaries and teachers, my dear colleagues and students, it's my pleasure to join in this COVID-19 sequel to discuss something about the role of pharmacist in managing patients during COVID-19. So this is K.V. Gopinath, pharmacy officer from Tirumala Tirupati Devasthanam, Tirupati. Next slide, please. Next slide. Okay, before starting my presentation, let me greet long life for all. Happy Immunization Week. It started 23rd of April 2022 to 30th of April 2022. So by knowing and recognizing the value of vaccine, COVID vaccine, to extend our life. So happy Immunization Day. Next. So now I'm going to discuss about what is the role of pharmacist in managing COVID-19 patients. Generally, pharmacists play an important role, not only in application of may I audible, sir?
You are audible, sir.
Okay, thank you. I repeat it. So in this presentation, I'm going to discuss something about the role of pharmacist in managing COVID-19. So most of the people will think that the pharmacists are involved in the application of drugs for managing diseases. Besides that, the pharmacist will also be involved in the preparation of quality vaccines, therapeutics and biologicals, diagnostic kits and supplies in order to prevent and minimize the infection in public. So besides that, even they are also responsible for assessing the effectiveness, responsible for assessing the quality of the preparation and its efficacy in human beings. And secondly, they are also responsible for inventory management of the vaccines, therapeutics, diagnostic kits and supplies, then patient care by doing optimization of antibodies for giving the vaccines and booster dose for the patients. So they're also helping the healthcare professionals in care plan for the patient. And finally, they're also responsible for giving accurate information on drugs and patient counseling. And finally, I'm going to conclude the program. Next slide. Next slide, please. Next slide. So now I'm going to discuss about the vaccine preparation. Briefly, I'm going to explain how the vaccines are prepared. What are the types of vaccines are available to minimize the cross-contamination of the virus. So broadly, it is classified into two types. whole virus vaccine is there, and mRNA vaccines are there. And besides that, there are replication and non-replication viral vectors also there. VLP are there, virus-like particles and protein subunits are used in the preparation of vaccines. When we are coming to the whole virus vaccine, the best example is our Covaxin, which is a live attenuated copies of the virus are present used. It may be a weakened or inactivated that can be suspended in the form of nanoparticle in a tris buffer solution using various additives in order to have a extended shelf life. Similarly, when we are coming to the modified RNA vaccine, the examples are Pfizer, BioNTech, Moderna, and Johnson & Johnson vaccines are coming under this group. Here, actually, the part of the DNA part of the genetic material, either RNA or DNA or fragments of the RNA and DNA are introduced into the vector, thereby into the host cell. Thereby, it will train our body to develop the antibodies. So these antibodies will protect our body on subsequent entry of any viruses. That is COVID-19 virus. This preparation can also be added with lipids as an additives, and finally it is going to be suspended in the form of a nanoparticle in saline solutions called tris buffer, so that the shelf life of this preparation can be extended. Next one. So these are the broad. So when we do have more than one preparation, there are many questions, queries will be there. Does the preparation is effective? Does it is efficacious over another preparation? So in order to rule out that, one should know what is the effectiveness and what is the efficacy of the preparation. That can be done by means of a head services like clinical trials. So in the case of clinical trials, a set of people as per the recruited as per the protocol, and they will be given with vaccination. COVID-19 vaccines are given, and the outcome parameters like the number of people who are protected from the diseases are going to be measured. When it is going to be compared with control group, then you will find the efficacy. Efficacy is nothing but the maximum effect of a vaccine, that is known as efficacy. So when this outcome parameter, when it is going to be compared with in a general population, then you will get the effectiveness. So when you are comparing with general population, that we know as real world evaluation of research. So here there will be a possibility of interventions with the patient, but as in case of control group, when you are comparing with the control group, there will not be any interventions. Only the data can be assessed so that the efficacy of the preparation can be detected. So that is not. So efficacy is nothing but it is a maximum effect or the maximum number of people who are getting protected from the COVID-19 after vaccination, that is known as efficacy. These results, when you are going to compare with the control group, you will know the efficacy. So effectiveness, so all the preparation, either it is a whole virus vaccine or it may be a vector-based vaccine, all are generically, they are very effective, but there will be a difference in efficacy. How to find out the efficacy of these preparations? What are all the various parameters you have to consider for the study? So in this case, I'm going to compare the efficacy of the preparations Covaxin and Covishield. So the first one is the seropositivity. Seropositivity in response to the COVID infection or in response to the vaccination, there is a possibility of developing immunoglobulin M at the early stage of COVID infection or the vaccination. There will be a production of immunoglobulin M, which is responsible for, it is nothing but it is a antibodies which will protect our body from COVID infection. So the immunoglobulin M, which is having a half-life of 14 days and it will last for 28 days. So over a period of time, in the meanwhile, immunoglobulin G will be produced by the body that will take care of our body to 42 days. which is having a half-life of 24 days. So in this seropositivity, you are going to measure how much of immunoglobulin M and how much of immunoglobulin G and joint detection, either of these two antibodies present in the body to fight against the entry of the COVID virus. It is, see, virus is nothing but it is an antigen. It is a protein. It is a protein. So in this particular study, it was found that the Covishield is efficacious. It is having 98.1% of coverage on comparison with previous. Coming to the Covaxin, it is just 53% or effective, capable of producing the antibodies. Next one. Okay, please. No, please go back. Please go slowly. Okay. So in this particular one, the Covaxin is lesser inferior in producing immunoglobulin G, immunoglobulin M, and either of these two immunoglobulins on comparison with Covishield. So this is the reference that I got it from the PubMed. Next one. The second parameter is rise in anti-spike antibody. See, here we are going to titer. So here exactly the anti-spike antibodies which are responsible for protecting our body from the spike protein. Spike protein is nothing but it is a virus which is having a special crown-like structure which is responsible for giving COVID disease in host cell. So this anti-spike antibody, especially this will be developed in host cell after 2 weeks of the vaccine that we are giving, or 4 weeks after the COVID infection is taking place in the human body. So this anti-spike, when we are comparing the data, so Covishield is having 127%, almost rise. See, it is going to be measured a arbitrary value, AU per ml. So here the number of particles, Covishield, 127 particles of antibodies, anti-spike antibodies are readily available to fight against the COVID infection or the virus infection. So when you are comparing with Covaxin, it is just about 53%. So this is also one of the parameters we are going to use in assessing efficacy of a two set of preparations. So this type of protection is known as COVID protect. Here we are going to titer. Actually, we are going to find the number of particles of the COVID anti-spike antibodies are readily available to fight against the entry of COVID infection antigens. Next one. So third point is breakthrough infections. So it is nothing but the vaccinated people, how these people are getting reinfected. So this is also one of the parameters are used to assess the vaccines. When you are coming to the Covishield, it is little higher. There is a probability of getting diseases, reinfection in Covishield is little higher when it is compared with Covaxin. It may be due to application of the lesser population. There may be some deviations. But in this particular study, it was shown that the Covishield is having, there is a high breakthrough infections when it is comparing with Covaxin. Next one. Next slide, please. Next slide. So now we are going to the vaccine induced adverse drug reactions. So it is going to be strictly monitored through a separate system known as Vaccine Adverse Event Reporting System, VAERS. That is popularly known as VAERS. But both the preparations, either Covaxin or Covishield, no serious adverse events are reported so far. But when you are comparing with other vector-based vaccines, globally available vaccines, there is a high serious adverse events are reported. But when you are comparing these two vaccines, the Covishield is having 18.1% of adverse reactions when it's comparing with Covaxin. So both the vaccines are highly compatible in community practice. Next one. Now I'm going to talk about the COVID-19 treatment. Being a pharmacist, one should know the treatment plan for COVID-19 patients, there are 4 to 5 set of classes of drugs are there. For example, the first class of drug is antibody cocktails, antibodies. Here the antibodies are directly, here the immunity or mob induced immunity, that is passive immunity. Directly you are going to introduce the antibodies into the system so that it will take care of our body, so that the disease progression can be minimized or stopped. For example, under this category, antibodies, mob, otherwise you can monoclonal antibodies. Directly we are giving into the human system. Kesari mob and MDV mob, one set of, it is having a complementary mechanism in producing antibodies. I mean, directly it will give wide coverage towards the antigens, that is COVID-19 virus. Then second preparation in the same category is Mamlani and ATCV. It is also coming under the antibodies. It is a antibodies directly we are giving. It is something like we are giving passive immunity to the host so that they will fight against the virus. Then you have remdesivir, antiviral drugs. So this set of class of drugs, antivirals, it will stop the replication of the virus in the host cell. So example, you have remdesivir is there, molnupiravir is there, nirmatrelvir plus ritonavir. So these three set of drugs which are having or minimizing the replication of the COVID-19 virus, so that the disease progression further can be minimized. Then you have a drug, tocilizumab, which is capable of inhibiting the cytokine storm, especially in the moderate and severe COVID infection. There will be lungs can get damaged because of the cytokine storm, interleukins, especially interleukin 6. We see interleukins are 1,000 times potent than histamines, so that there will be, it is something like pain mediators. When you are using this tocilizumab, it will minimize the cytokine storm in moderate and severe COVID-19 patients. So recently 2-deoxyglucose approved by the government of India in order to reduce the workload, dependency, oxygen dependency in COVID-19 patients. So it is also having some wonderful results are shown by applying this 2-DG. Then you have anti-inflammatory drugs like steroids, methylprednisolone and dexamethasone. Methylprednisolone at a dose of 2 mg and dexamethasone at a dose of 6 mg per kg body weight are used as anti-inflammatory drugs. And these are the preparations widely used in almost all the COVID-19 patients. So this is one of the preparation is directly approved by the ICMR. All other preparations are given under emergency use authorization. That is the status of those preparations. When coming to the hydroxychloroquine and chloroquine, excellent muscle relaxants, and it is having anti-inflammatory drug also, but its role is not well defined. So ICMR banned those preparations. Initially they are using it, but later on they banned it. Then we have ivermectin, which is a wide, broad spectrum anti-protozoal drug. It may be used singly or it may be combined with doxycycline. Especially it helps in Alzheimer's disease. Neurodegeneration can be minimized by mixing with doxycycline. So ivermectin independently or it may be in combination with doxycycline. It can also be used at the early stage of COVID-19, but due to no role or no specific role, ICMR banned this preparation also. Then you have lopinavir and ritonavir. This is also involved in stopping the replication of the virus because of the adverse drug reactions and other reasons. ICMR is banned. So we have, okay. Then we will go for reactogenicity of vaccine. So as we have in drugs, adverse drug reaction, but when coming to the vaccines, the reactions of the vaccine, that you can call it as reactogenicity. So when the vaccines are given for a patient, you can see some unwanted reactions of the vaccines. For example, the anaphylaxis, especially the anaphylaxis is almost 5 in 1 million. So that is the probability of this anaphylaxis reaction. Anaphylaxis can be spontaneous, which may be more serious, and it is very rare happening after the vaccination for the biological system. But there are certain conditions. Late anaphylactic reaction is going to be happen after 4 hours. So it will leave with mild symptoms. Skin rashes will be there, redness will be there, itching will be there, this type of anaphylaxis reaction. So these preparations can be minimized by applying. Serious reactions can be minimized by using adrenaline, decadron, and observing the vital signs to minimize this anaphylaxis. Second reactogenicity is TTS, thrombosis and thrombocytopenia. It is also very serious adverse reaction of the vaccine. Otherwise, we can call it as reactogenicity. So it is the symptoms are similar to ITP, inherent thrombocytopenia, where there will be a decreased platelet count and there will be a clotting. There will be a clotting in larger vessels. So when we are coming to this reactogenicity, TTS, the probability is 57 people are get affected in humans after administration of 17.8 million doses. So the probability of finding this TT is very less, but among 57, 9 people are confined to death. It is vaccine specific vaccination, Johnson & Johnson. So due to application of Johnson & Johnson vaccine, 57 people are affected with thrombosis TTS. Among these 57, 9 people were died. Then third one is GBS, Guillain-Barré syndrome is there. It is common to all the globally available vaccines, Johnson & Johnson, Pfizer, BioNTech, and Moderna. So in all this, it is something like nervous disorder. It is something like nervous disorder. There will be a weakness of the muscles and there will be a paralysis also there. These type of symptoms are there in 301 number of patients out of 1 million people. 1 million people. Then we have cardiac complications, myocarditis and pericarditis. Especially these type of symptoms are seen in early age of human beings. Even 30 years of age people, due to vaccination, there is a possibility of getting inflammation of the myocardium and also inner layers of the pericarditis. So these are asymptomatic with the patient, but they are very well responded with the treatment. So there will not be any harm for the people. That is a good sign. Then finally, death. Due to vaccines, the death rate is about 0.0022%, very, very negligible. So as of the statistics are concerned, 11,408 people are died out of 1 million. 529 million doses of COVID vaccine. So the interesting relationship in this is 80% of the people are not vaccinated. The death happened in human beings, 80% people are not vaccinated. Only 20% people are vaccinated, they are died. So that shows the importance of vaccination. Next one. Next slide. So now I'm going to find what is the impact of COVID infection. How does the adverse events are happening? It damages the multiple organs of the human system. And what are the adverse events are noted during the vaccination? So the risk differences between this vaccination and SARS-CoV infection. So the red bars, for example, you have arrhythmias. 166 people are get affected due to COVID-2 infection per 1 lakh population. 1 lakh population. So due to COVID infection, there will be a cardiac problems like arrhythmias are there. Then you have myocarditis there. About 11%, 11 people are get affected. And you have even pericarditis there. Then you have kidney damage, acute kidney diseases, 125 people out of 1 lakh people. It injures your kidney due to COVID infection. Then you have respiratory problems, pulmonary embolism. 62 people are get affected. Besides that, the cardiac problems like myocarditis, pericarditis there. even myocardial infarction will also be there. All these damages just because of the COVID infection. These results are compared with vaccinated people. So what are the adverse events are there? So there is a reversal. So the kidney damage is reversed, arrhythmias are get reversed, pulmonary embolism can also be reversed. So that is the impact of vaccination. Although there are some adverse events, but whatever the organ damages are happened just because of the COVID infection, all those are reversed because of the vaccination. But interestingly, due to vaccination, there are certain diseases, lymphadenopathy. It is a new diseases are happening in the human system, and also there will be a virus infection. Herpes zoster infection also be there with vaccination. So these are this is how we have to differentiate. So vaccination versus COVID infection. So it will give a good impact to understand what is the importance of vaccination in human beings. Next one. Next one, please. Now I am going to discuss about the exact what the pharmacists do in hospital practice. So no doubt, pharmacists play an important role in supply of medicines, supplies, vaccines, and therapeutics. When you are coming to the medicines, already I said that when you are coming to the supplies like face masks, N95 masks, face shields, PPE kits, sanitizers. So you should be ready, and you should be ready as per the demand. You have to keep it in the inventory. Then vaccines, you have to procure the vaccines, and it should be distributed rationally for the public, and make sure that pharmacy services are extended round the clock 24/7, and pharmacists also involved in close contact services. There is a debate whether the pharmacists are eligible to give injections or not. Injection in the sense either it is a vaccine or intramuscular. So no doubt pharmacists are eligible. See, any person are eligible if they are going to give injections in presence of a physician. So even nurse cannot be eligible to give injections. But this is a close contact services where even pharmacists with a skill of giving injections, they can start doing this practice. And also COVID testing, it is a matter of just 3 minutes. COVID test can also be done in a pharmacy, especially in the community services. Without depend on any other, you can do this test, rapid test for antigen, rapid test for antibodies, and together test will also be there. Then hospital isolation and sanitization, especially when COVID patients are entering into the hospital, knowingly or unknowingly. If you do find that they are COVID infected patient, the hospital should be isolated. So all the hospitals should be sanitized with the hypochlorite solution, and make sure that it is free from virus. Then you have to admit the patients for further treatment. So all these activities as per the protocols of the central and state ministries. Then attending the patient request. There are so many queries for the patient because of the easy access. So patient will have drug-related queries or disease-related queries or even testing, COVID-19 test queries. You must be ready to answer all these questions. Then even the mechanism of drug distribution that can be simplified by addressing or by adopting refilling, labeling, and brown cover packages for the patients. And pharmacists will also be involved in disease management system, especially they are eligible for treating the patient for patients at home care, at the doorstep of the patient. So all chronic diseases can also, because most of the hospitals are closed during the COVID-19. So there is a good chance for the pharmacists, especially if they are trained clinically, they can take care of the patient at the doorstep of the patient. The pharmacist can also be involved in clinical development of the clinical protocols and hospital administration. Because of the clinical pharmacists, they can design clinical protocols so that the research, education, and practice and leadership to lead the team can also be there with the pharmacists. Here the picture is inventory management. These are the two people who are working with me in my inventory management. Next slide. So pharmacists also be involved in in development of the clinical guidelines by reviewing the literature. This is also one of the important activity of a clinical pharmacist. You have to review the literature and you have to design the protocol. I will give you one example how the protocol really help in hospital practice. Then even you have to set the quantities required in the for the various units that are available in the hospital. Then one more important activity is reporting of medication related errors. This is also one of the, pharmacists should be there as a part of the review committee in every hospital, so that they will take care of any drug related issues or errors, so that it can be rectified in near future. And finally, even the services, there could be a rapid access for the emergency medications. So there should be a flexibility in drug distribution system. You have to be very flexible. You have to come out of your protocols of your hospital due to COVID-19. So all medications should be easily available for all the people in hospital, so that it will run smoothly. So these are the one of the picture shows that this is one of the example, pre-packing. So all the drugs are kept in a brown cover with a label. It will be handed over to the COVID patient, so that there will be a minimum contact with the patients. Next one. Next slide. So this is one of the simplest way. No need to test the patient, COVID-19 patient. By screening, by applying a questionnaire, you can make decision for the patient. For example, this is one of the questionnaire developed as per the aims. Developed a questionnaire. It consisting of 7 questions will be there. Each question will be weighed. Weightage is given. For example, if your patient is having a travel history, you have to give 3 marks. If the patient is having COVID, contact with the COVID patient, you have to give 3 weightage. If the patient is having fever and myalgia, one mark is given. Dry cough, 1 mark. Shortness of breath, 1 mark. And history of similar symptoms in family or friends, 1 mark. And if you are a healthcare worker, 1 mark will be given. So the total score will come around 11. So if the patient is having a score of equal or less than 3, automatically you can send him to a quarantine, home quarantine. Home quarantine with ideal food, healthy food, and supplements that will help the patient to come out of the disease. When the score is 4 to 8, so that such type of patient you have to send it. Here there is no need of even testing the COVID patients with a rapid test or RT-PCR. By applying the questionnaire, take the questionnaire and take the responses and weigh the condition of the patient. So if the patient is having 4 to 8 weights, then you send him to the hospital quarantine, so that they will take care of the patient. If the score is greater than 9, then there is a critical condition. So he has to be sent for isolation ward, and further investigation and treatment is provided. So this type of questionnaires one has to develop in every hospital, so that you can minimize the cost involved in screening of the patient. See, this is not done by me. This is the ICMR project. They have designed a questionnaire. Next slide. Next slide. So what is the role of pharmacist in infection control? If you do have digitalization and automation of all the services of a pharmacy, most of the infection can be minimized or regulated. So for that, if we do fail for digitalization or for prescription and all, automation of services, use landlines, mobiles, drop boxes, fax machines, and intra and internet facilities can be used, so that the traffic within the pharmacy can be minimized by the colleagues and even patients. So if any patient, unused medicines are there with the patient, you would just discard it, put it by the incineration. You have to discard it. Don't use it for other people. So no doubt social distancing and floor markings of 1 meter apart, everyone knows it. And the bulk packings can be made into a unit packing. So that is helps in easy administration for the patients. Then change in mode of drug delivery also. Instead of going for parenterals, if you go for IV push, so that the contact time and transit time will be less for the patient within the hospital. So even the change in drug delivery system will also change the infection control. If you are going to give IV injection, it will run for 15 to 30 minutes. So over a period of time, there is a possibility of getting cross-contamination. So in order to avoid that, all the IV fluids, wherever there is a possibility, go for IV push. That will minimize the contact time with the patient. Then sourcing and using of PPE kits and installation of hand sanitizer stations and plexi dividers in the hospital will minimize the cross-contamination. And finally, even pharmacists play an important role in helping the consumers, patients, to buy the quality supplies. Already I said that the supplies coming under face masks, N95 masks, flexis, whatever it is. So all this comes under quality. So this is how the pharmacist can minimize the infection by changing the services in a hospital. Next one. Next slide. So CDC also issued guidelines for the pharmacy. No sick person. See, the pharmacy or healthcare worker should not be a source of infection for the patients. So there is a guidelines for pharmacy. Sick person should not report to work. There will not be any punitive punishment for the patients. Don't handle any kind of objects or documents of the patient. Non-touch process wherever there is a possibility. There is no need of PPE kits, especially for filling the prescriptions. But you can use face shields or face covers while doing prescription dealing. Then close contact services like vaccinations and COVID-19 testings. See that it should be properly fitted with a respirator. Then you have used plexiglasses in the hospital and pharmacy premises. Then there should be a separate drop box, or there will be a separate counter for keeping medicine so that the patient can take directly. Don't hand it over the medicines to the patient. Then social distancing and sanitizer use, and these are the common, everyone knows it. Then finally, even it is better, encouraged to use self-checkout, drive-through or delivery services so that it limits the number of people entering into the pharmacy. So these are some of the guidelines are issued by the Center for Disease Control for the pharmacists. Next one. So what are the clinical responsibilities? Already I said that. So being a clinical pharmacist, you have a chance. There is a possibility. You can you will become a member of the multidisciplinary team so that you can visit the patient in a isolated patients. So pharmacists should be very active, especially for giving some recommendations like anticoagulation management, heparin. For example, when to start heparin, when to stop heparin, when to resume heparin. See, this type of activities supposed to be done, expected to do by a pharmacist. See, generally it will also be done by the physician, even sisters also be involved. But being a pharmacist, you should also be trained in this area so that you will have a new opportunities. So anticoagulation management, it is also one of the important services one has to learn. I will give you the protocol, how to monitor this heparin in the coming slides. Then antibiogram. Each and every hospital should develop an antibiogram in order to have optimal drug concentration at the targeted tissues. So I have seen no pharmacy, no hospitals are maintaining this, so that there will be additional burden for the hospital management. So then polypharmacy, more than one drug, that is known as polypharmacy, it leads to lot of issues. The activity of drug will be increased, decreased, or no activity will be taking place. Then chronic disease management, this is also one of the important chance for working for the clinical pharmacist. So whenever there is a chronic disease management, so as you know that chronic diseases, asthma, diabetes, epilepsy, all these things, if you do have a refillings, if you have clinical knowledge, you can manage the patient at the doorstep of the patient after getting prior authorization from the physician. That is important. So you have to get an authorization from a physician, then you can visit the home of a patient, then you can start giving the, so that for that you need lot of skills, lot of giving injections to drug related issues, everything you have to manage independently. For that we need clinical pharmacy knowledge. Then drug interaction, disease drug interaction, drug interaction, drug food interaction, this also the other activities of a clinical pharmacist. And also the clinical pharmacists are responsible for review of patients with complex illness, especially for optimization prior to drug treatment. This is also one of the important area where we can do clinical responsibilities. Then next one. When you are in a multidisciplinary team, as a clinical pharmacist, what you can do? You can increase the dose, you can decrease the dose, you can go for optimization of the therapy with outcome parameters. By using some outcome parameters, you can go for therapeutic substitution, formulary substitutions, drug-drug interactions, disease-drug interaction, discontinuing the medication and starting a new medication. All these activities, when you are moving with the expert doctors, there is a possibility you can show your talent, your skill, so that the patient will get benefited. Even you can go for pharmacokinetic reviews of various dosage forms, anticoagulation therapy, even for total parenteral nutrition. Calculated calories of the drug, food can be given, administered for the patients. You can go for even renal function, lung function, monitoring. All these activities can also be done by a clinical pharmacist. Next one. So this is how, this is the suggestions given for the resume for warfarin. So if we have a clinical knowledge, you can go, you can fairly manage the patient in a hospital. For example, in day 1 and 2, when the patient is having the INR ratio, when it is less than 1.3, the prothrombin levels are less than 17 seconds, give 5 mg of warfarin. So that is the loading dose for day 1 and 2. Loading doses are not higher. What the drug you are going to put for the patient on day 1 and 2, 5 mg. Especially you have to think what is INR, what is the value it is supposed to be. So when the value is less than, see that the INR ratio should be as much as 3 to 4, in between 3 to 4. When it is less than 3 and 4, you have to adjust the dose of warfarin. The warfarin, which is a highly lipophilic drug. So the free drug will be available in the serum, so that there will be a drug toxicity. Drug toxicity will be there. So in order to arrest, see, the pharmacist is an excellent therapy manager, because you know the profile of a drug, you know the profile of a patient, so that you can monitor this fairly good when comparing with other healthcare workers, so that you can assist the physician in treating the patient. So in day 3, when the INR ratio, if it is less than 1.5, 10 mg given. When the INR is reached to 3, there is no need of, you have to stop giving warfarin. Just stop it. When you are coming to the 4th day, when the INR is less than 1.6, again you start giving. So what I mean to say here, when to start, when to stop, when to resume. It can be based upon the certain clinical parameters. In this particular case, INR is the parameter. So on day 4, if it is the patient is having less than 1.6, you start giving dose of 10 mg. When it reaches greater than 4, you just stop warfarin, so that the optimization of warfarin can be fairly managed in patients. Next one. So prophylactic management of COVID. So when you are coming to the treatment, instead of prophylactic means prevention rather than detection. That is the meaning. So when you are going, see, besides vaccination, our own management, Thirumal Tirupati Devasthanam, they given homeo medicines and Ayurveda preparations for each and every employee, so that they will be, their health will be protected, so that they can do better service for the patient. So the homeo medicines like arsenica album 30, Rostox 200 mg is given at free of cost for every employee and even for the citizens. And then Ayurvedic preparation, immunoboosters, Amruta, it is an antipyretic drug, immunobooster, tablet, Amruta in the form of tablet as well as churna. It is botanically Tinospora cordifolia. So Nimba Thylum also given, nasal drops, oil that can be instilled into the nasal passage so that the virus can be destroyed. Then even Dupum. So Rashoglina, Dupum also provided in order to avoid the infection of COVID in residences as well as in the hospitals. And Pavitra hand, all these preparations are prepared in our own management in a Srinivasa Ayurveda pharmacy. Then you have rehabilitation for the COVID-19. So patients who are infected with COVID-19, so better to go for rehabilitation by giving add-on yoga-based practices, pranayama and Bastika pranayama. So that will improve the lung function so that they will have a better immunity and tolerance for towards the disease. And even this pranayama and Bastika pranayama can also be used as a rehabilitation for the vulnerable patients like geriatric, pediatric, and comorbid conditions, so that they will feel happy and healthy. And food also, food will have a good value. It influences your health system. If you have a yogic diet or good diet, automatically there will be a good immunity to face the COVID infections. There will be a better tolerance to prevent COVID infection. Next one. Next slide. So now I'm going to give some case presentation, few case presentation where a pharmacist can play an important role. For example, under this patient, a 50-year-old patient is prescribed with enoxaparin 40 mg, subcutaneous 1 OD. Generally, this drug is prescribed for anticoagulation as a prophylactic to prevent blood clots in the patient. Unfortunately, the patient is criteria BMI is more than 40 kg per square meter. So it demands more than 40 mg. So, but this particular patient is given 1 OD subcutaneous of enoxaparin, it may not sufficient. So under dosage so that the outcome may not be good. Thereby, being a pharmaceutical intervention, you can increase the dose of 40 mg BID. Otherwise, 80 mg can also be given at a time, but you need to be very cautious when you are using a higher loading dose. Better give 40 mg subcutaneous every 12 hours so that the problem of under dosage can be minimized. Second one. Next slide. So the pharmaceutical intervention study, this is also one of the studies. Say when a COVID patient with a diarrhea. So when this type of problem comes, so on the right side, I'm going to explain. A 60-year COVID patient comes to a hospital with a diarrhea. So he is treated with loperamide. Loperamide is contraindicated in COVID-19 patients with a diarrhea. That is important. So for that, you have to develop, for every drug, you have to develop a clinical protocol in every hospital. Accordingly, we have to follow. So in this particular case, loperamide is contraindicated. Why? Because loperamide is an anti-motility drug. So that when it's given for managing diarrhea, the transit time and transit time of COVID-19 will be increased. So the COVID-19 disease will be prolonged. So instead of that, you have to go for alternative medicines like kaolin or pectin preparation can also be used. Otherwise, diazomectite or preferably capsule, Sequele 100 mg, 1 OD can be given. It is an anti-secretory agent. So this is how, this is one of the case study where the contraindicated drug is prescribed for a patient. Alternatively, a pharmacist can give suggestions to use anti-secretory agents like kaolin, pectin, or Sequele. So when this type of case studies are there, so what you have to do, how to design the protocol. So this is the way on the COVID-19 patient with diarrhea, test the RT-PCR for the stools. If it is positive, treat accordingly as per the protocol of the COVID-19 patient. If it is negative, you can go for anti-diarrheal. Loperamide can be given without any further compliance. Then you have to rule it out whether this diarrhea is because of drug induced. See, COVID patients are treated with antiviral drugs and high antibiotics also. So you have to make sure that whether this diarrhea is drug induced. If it is yes, the condition is serious, you have to think. If it is serious, withdraw the. So you have to weigh the severity of the condition. Accordingly, either you have to withdraw the drug and give the supplementaries and give the large volume parenterals and correct the disturbances in the minerals. So this is how a clinical pharmacist have to design not only for the loperamide, for every drug, new drug, you have to make protocols like this. That helps for prescribers as well as for the other healthcare professionals. Next one. Next one. Now case study 3, wrong duration of the treatment. So the patient is treated with dexamethasone 6 mg for 1 month. Generally these anti-inflammatory steroids can be given only for 10 days. When it is given more than 10 days, there will be a adrenal suppression so that the patient will develop weight loss, hypertension, cold extremities, fatigue, low appetite, and body pains. Managing this drug, there is a need of even emergency room. You have to work lab work. You have to check the hemoglobin, blood pressure, and serum electrolytes, especially potassium. The correction procedure, it will take almost 3 to 10 days. It depends upon the severity. And that's why I'm telling you, while giving the treatment itself, when you are dealing with the dexamethasone, how many days it should be used. Being a pharmacist, you have to watch while going for the rounds and see that the patient is using more than the specified days. You have to give an input to the physician so that there will be a corrections or will be there in the protocol for that particular patient. So this is one of the example for wrong duration of the treatment for the patient. Next case study. So prescription of contraindication drug, favipiravir. This is one of the antiviral drug when it is given for the COVID positive patient, especially given for the pregnant. So this drug is contraindicated in first trimester. It will affect the fetus. So you should be very vigilant while using this type of new drugs in community practice. Next one. So wrong drug or unnecessary wrong drug or unnecessary drug in prescriptions. So whenever there is a suspicious COVID patient, suspicious, not confirmed cases, with mild symptoms, there is no dyspnea, no respiratory system are involved, no cough, no cold, nothing is there. There is no any breathing disturbance for the patient. In such cases, prescribing azithromycin, there is no meaningless. Most of the people, when people are on suspicious cases, just they are dumping azithromycin, 500 to 1000 mg, 500 to 1000 mg, along with even amoxicillin with clavulanic acid. They are using it for treating the pneumonia, COVID-induced pneumonia on suspicious cases. You have to work the lab work, then you have to go for using higher antibiotics in patients. Even unnecessarily, the people are dumping the supplements, vitamin D, zinc, and all. See, even I have seen a case study. I have given you one project, this one. Methylcobalamin, there is a drug accumulation in the patient, COVID-19 treated patients. It is unnecessary. You are subjecting so much of drug dumping into the patient. Say how much drug is needed, you have to calculate. Accordingly, you have to treat the patient. Otherwise, there is, see, generally B complex is water soluble, but there is some abnormalities. There is accumulations are taking place. I have seen cases, I have given even assignment as a project on methylcobalamin. How does it is possible to take accumulation within the bodies? So this is one of the, say unnecessarily don't dump the prescriptions. So wrong medication, unnecessary drug should not be there in the prescriptions. So it is one of the responsibility of a clinical pharmacist. Then next one. Next slide. So this is the case study, especially when people are using telmisartan, ACE inhibitors, and ARB, excellent medicines for managing hypertension. But here the patient is switched over to the amlodipine without no reason. It is not necessary, especially COVID-19 patients, telmisartan and ARBs are excellent medication, losartan and other preparations. It will do because it acts through ACE inhibitors. So the drugs will occupy the receptors so that there is no scope for the COVID-19 virus. So that may be one of the reason, and also it have added advantage in hypertension, myocardial and heart failure cases also when using ACE inhibitors and ARB. And the second one is in this case study, any COVID patient. Here also the patient yes. So in this seventh case study, a 42-year patient is treated with dextromethorphan syrup. So actually this is contraindicated for the COVID-19 patient as it is going to promote the viral replication. So, and see that the values of D-dimer and fibrinogen can be considered while prescribing this dextromethorphan. Next one. Next slide. So 65-year patient who is having a severe COVID-19 patient, having shortness of breath, whose saturation levels are 88%. So this is very serious patient. Giving levofloxacin, dexamethasone, and giving in a hospital or nearby community pharmacy hospital, there is no meaning. When the saturation levels less than 92%, immediately you switch this patient to the COVID center. They will take care of the patient. So these type of treatments are inappropriate. You can, if you know little knowledge, if you have clinical knowledge, you can avoid this type of treatment for the patients. Next one. So finally, I do conclude that pharmacists play an important role. They are in pivotal role in not only in the preparation of vaccines, they are also involved in critical care services if they have a chance. Already people are giving chances. See, most of the people, therapy manager. Who is a therapy manager? That is important. Therapy manager, he may be a physician, he may be a pharmacist, he may be a nurse. Who is the effective therapy manager? That makes a difference. All are therapy managers. All are in the team, in the expert committee. So if you do work together so that there will be a complementary mechanism in treating the patient. So the pharmacists play an important role in not only the preparations and also in clinical trials, testing the effectiveness and efficacy and also clinical care services so that it will have a lot of influence over the health determinants, socio-economic and environmental factors it influences. Thereby, you can reduce the morbidity and mortality. Thereby, the nation's economy can be improved. Thank you so much for giving this opportunity. Next slide. I must say thanks to our professors, Professor Anantanaik Nagap sir, Professor N. Udupa sir, Hanumantachari Joshi sir, Pawan Kumar, and Dr. K.S.G. Arun Kumaran sir, Dr. V. Gopal, and organizer of this event, Dr. Gampa Vijay Kumar, and management of Sarada Vilas College and KGR Institutes, and my own officers, Dr. R.B.S. Muralidhar, Chief Medical Officer, for giving this permission to deal this event. And finally, my own colleagues, Raghu, Archana, and Mrs. Ratna Manika. Thank you so much. Thank you so much for giving this opportunity.
Thank you, sir. It was a wonderful and informative session. Now I request Dr. Ravindra P. Chaudhary, Assistant Professor, Department of Pharmacy Practice, Sharda Vilas College of Pharmacy, Mysuru, to introduce our speaker, Dr. D. AkilaDevi. Please, sir.
Good afternoon, one and all. Myself, Dr. Ravindra P. Chaudhary, Assistant Professor, Sharda Vilas College of Pharmacy. I take privilege to introduce a speaker, that is Dr. D. AkilaDevi. So, ma'am is recently working as Associate Professor in Wells Institute of Science, Technology, and Advanced Studies. So, ma'am has completed PG and PhD in Pharmaceutical Sciences and Pharmaceutics from the College of Pharmacy, Madras Medical College, Tamil Nadu. Ma'am has total of 15 years teaching experience. In that, research experience also 5 years are included, and 1.5 years of industrial experience also included. So ma'am has published around 45 publications. Among 45, 15 are international and 30 are national journals. So ma'am also has like Scopus index numbers, that is 15, and 25 Google Scholar articles are there. And ma'am has one Indian patent and ma'am has published 5 books in the various publications. So ma'am is a lifetime member of APTI and IPA, and ma'am has organized various conferences and attended and presented the various posters in the various conferences. So with this brief introduction, I would like to welcome you, ma'am.
Thank you for your brief introduction, sir.
Yes, ma'am. So can you kindly take over the session, ma'am?
Yes,
Hearty welcome to you, Akila madam. Don't worry, we are there with you because number doesn't matter. The quality matters. We are eagerly waiting for your talk.
yes, sir. Yes, sir. Am I audible, sir? Good afternoon, everyone.
Yes, madam. You are audible and as well as your
Dignitaries on and off the interface, respected faculty members, my dear students and my dear colleagues, I am Dr. D. AkilaDevi, working as an associate professor in Department of Pharmaceutics, School of Pharmaceutical Sciences, VISTAS. I am very happy to join in this COVID-19 Sequele series. My topic on this session is about clinical implications of vaccines in COVID-19 patients. Today, I would like to present what is COVID-19 and its variants, pathophysiology and diagnosis, the different types of vaccines and its mechanism, optimization of antibodies, booster dose, what is reactogenicity, and then biomedical wastage of COVID-19. Finally, I want to conclude the session. The importance of this webinar is to show the magnitude of the problem involving the socio-economic and environmental issues. There is a lot of financial burden and healthcare costs in management of COVID-19 virus and its variants, and hence there was a need of vaccination, including the primary as well as the booster doses, in order to reduce the morbidity and mortality in the COVID-19 patients. And then there was a big headache of biomedical wastage management. So as per on the 3 days, the statistical data reveals that 186 crore of vaccination doses were administered to priority-based frontline workers, and then that is children starting from the year of 12 to 14 years, and then healthcare professionals, and then for out of which 134.82 crores are fully vaccinated, where they received the primary and the booster doses, and out of which 60.96% are fully vaccinated by the government of the India, and then out of which 1.79% citizens of India, they received the booster dose, and these are all the worldwide survey. So nothing to say about COVID-19 and its variants. So it is a severe acute respiratory syndrome associated coronavirus, which causes the COVID-19. The spike protein present on the surface of the SARS-CoV-2 is an example of the antigen. So there are the variants, that is spike proteins with severe mutations. Several mutations are there, alpha, beta, gamma, as well as the delta and omicron. The spike protein present on the surface of the COVID-19 virus, it target the vaccines as well as the antibody drugs, etc. And then these spikes used by the virus, they attach and then they infect the cell. And then this COVID-19 virus is an RNA messenger virus, and it consists of 4 types of the proteins. Example, that is spike glycoprotein, membrane protein, as well as the envelope protein, and then RNA nucleocapsid protein. And this spike protein, it has more affinity towards the ACE receptors present in the vital parts of the human body, that is goblet cells of lungs, liver, and then intestine, etc. So as well, they damage the tissues. So in this slide, we have this COVID variants and the consequential effects. So this spike protein, it consists of 2 receptors, that is S1 and S2. This S1 is the RBD domain, which has more affinity towards the angiotensin converting enzyme, which is present in the human cells. When and where this RBD binds with that of the ACE receptor, there would be a lot of reinfection, infection, and increase in transmissibility and increase in infectivity. And that there is a need of COVID vaccine matching and its effectiveness. Hence, a lot of COVID therapeutics should be there. And then we have this therapeutics, we have this prophylactic as well as the therapeutic vaccines are available. And then therapeutic vaccines are readily available antibodies, that is called as the immunoglobulins. So can't move this slides. Okay. So neutralization reaction, that is antigen versus antibody. So here the spike protein present on the SARS-CoV-2 virus, it enters into the host cells where it gets binds with that of the AC receptor present in the goblet cells of the lungs, liver, etc. And then the second step, it replicates in the host cell. And then the third step, it enters into the antigen presenting cell, whereas the virus is phagocytized and the antigen gets released. And this antigen, that is called as a spike protein, and then this antigen, it stimulates the T helper cells as well as the memory beta cells, whereby the antibodies are released, and then neutralization reaction, that is antigen antibody reaction, will be taking place. And this production of the antibodies, it further prevents a subsequent entry of the antigen. So coming to the COVID-19 disease process, in response to the virus, the disease process occurs in 3 stages. That is stage one, which is otherwise called as a viral response phase. It occurs between 0 to 3 to 5 days. So it is in this the virus will, so we have the clinical symptoms, that is mild constitutional symptoms, fever more than 99.6 Fahrenheit, and then dry cough, diarrhea and headache. And then the clinical signs are lymphopenia, increased in prothrombin time, and then increased in D-dimer, and then LDH mild will be there. And the second stage, that is called as the pulmonary phase, we have the enormous increase in viral infection. So the clinical, this stage will be varying from 5 to 8 days, and the clinical symptoms are shortness of breath as well as the hypoxia, that is the oxygen saturated level will be below 92 mmHg. And the clinical signs, we have this abnormal chest imaging, transaminitis and low normal procalcitonin level. And the stage 3 is called as a hyperinflammation phase or cytokine storm phase. And the clinical symptoms, we have this acute respiratory distress syndrome and then systemic inflammatory respiratory syndrome, which leads to the shock and the cardiac failure. And the clinical signs, we have this elevated inflammatory markers, CRP, LDH, and then interleukin-6, D-dimer, ferritin, troponin, NT-proBNP elevations. The potential therapies of this COVID-19 disease, we have this antiviral drugs such as remdesivir, chloroquine, hydroxychloroquine, and the anti-inflammatory drugs such as corticosteroids. And then we have this immunosuppressive agents such as interleukin inhibitors, etc. And then convalescent plasma transfusions. So the diagnosis of the COVID-19 test, we have this 3 types of tests, that is antigen test, rapid kit antigen test, and rapid kit antibody test, and the total antigen and the antibody test. So after in the first stage, after the COVID patient gets the infection, the antigen will be present in the first 7 days, and we'll be doing this rapid kit test of antigen test. If the person gets positive, it will be confirmed as a it will be confirmed for the COVID-19, and the next stage, that is between the 7 to 14 days, enormous level of the IgG will be produced, that is the immunoglobulin M will be produced, and it has an off-life of 14 days. It will be gradually increased, and then we have a decline phase of 28 days, and then after that IgG will be produced, and then it will start at 14 days, and then we have a decline phase of 42 days. So in this period, when you test for the antibodies, that is a rapid test for antibodies, the COVID-19 patient, that is a virus will be confirmed. So if beside this, if there is no clinical symptoms, that is if a patient answers negative for antigen test as well as antibody test, so we have to go for the RT-PCR test, that is a final test if the patient has no clinical symptoms. So in order to train our immune system, we have the two types of categories of vaccines, that is the whole virus vaccines, live attenuated. It contains the copies of the virus that have been weakened or killed inactivated virus, and the viral component vaccines vector. So we have this DNA and RNA based vaccines. It contains viral genetic material which provides the instructions for making the viral proteins and then replicating viral vector. It contains viral genetic material packaged inside another harmless virus that can copy itself, and then non-replicating vaccines which cannot copy itself, and then virus-like particles. It contains viral proteins that mimic the structure of the virus, but no genetic material will be there. And the protein subunit, it contains isolated and purified viral proteins. So next, about the vaccines available in India, that is the indigenous COVID vaccines. We have this Covaxin and Covishield. So this Covaxin, it is a live attenuated inactive coronavirus prepared using aluminum hydroxide gel, TLR 7/8 agonist, and 2-phenoxyethanol and phosphate buffer saline. And the Covishield, it is an inactivated adenovirus with segments of coronavirus prepared using aluminum hydroxide gel, L-histidine hydrochloride monohydrate, polysorbate AD, ethanol, sucrose, and sodium chloride, and disodium ethate dihydrate. And apart from this, we have this globally available vaccines, that is mRNA vaccines of Pfizer, BioNTech, Moderna, Johnson & Johnson vaccines. This mRNA, it is a natural genetic material found in the human body. It helps in how to make the proteins. Modified mRNA in the vaccine teaches body how to make the protein found on the surface of the virus that causes the COVID-19. Whenever the body sees that protein, it starts making the antibodies, then stand ready to sock and destroy the virus. So some of the lipid adjuvants present in the vaccines are lipids, fatty oil-like particles, and the saline solution called as Swiss buffer or the adjuvants present in the vaccines. So this slide, it shows about the primary COVID-19 vaccine dosage for the patient age groups which are categorized above 18 years, 12 to 17 years, and then 5 to 11 years. So this indigenous vaccines, we have this Covaxin, Covishield of 0.5 ml are administered to the patient. And if it is of the Pfizer, BioNTech, Moderna vaccine, 0.3 ml should be administered as a primary dose. And if it is of Janssen, a single dose can be given for the patient above 18 years. And if the patient group is having 12 to fall under 12 to 17 years, the first dose of 0.3 ml Pfizer BioNTech should be given, and later on the second dose can be given. And then between the years of that is 5 to 11 years, first dose of 0.2 ml Pfizer BioNTech will be given, and followed by the second dose. So these are all the criteria which falls under for the immunocompromised patients, that is active treatment for solid tumor and malignancies, receipt of solid organ transplant, and then receipt of chimeric antigen receptor T cell or hematopoietic stem cell transplant, or immunosuppressive therapy, moderately or severe primary immunodeficiency, advanced or untreated HIV infections, and then active treatment with high dose steroids, anti-cancer drugs, immunosuppressive or modulators, and TNF blockers. So vaccine dosages in immunocompromised patients, we have this Covaxin, Covishield, and Moderna, Pfizer, BioNTech, and Janssen vaccine. So in immunocompromised patients having more than 18 years, the booster dose of Pfizer, BioNTech 0.3 ml or Moderna 0.5 ml after second dose of the primary series can be given. And then for the age group of 12 to 17 years, if that is the first dose of Pfizer and BioNTech has been received by the patient, the second booster dose of Pfizer same vaccine can be given, that is a Pfizer BioNTech 0.3 ml after 28 days of the primary series. And then when the age group is between 5 to 11 years, we have to administer an additional dose of Pfizer BioNTech 0.2 ml 28 days after the second dose. And then booster dose. So in patient age of varying about more than 18 years, Moderna, Pfizer, BioNTech, if any of the three vaccines after 5 months of the primary series can be given. But if we have administered the indigenous vaccine, that is a Covaxin or the that is a Covishield, So we can have a booster dose after 9 months, but for the globally available vaccines, the booster dose can be administered after 5 months of the primary series. And then if you are using the Johnson and Johnson vaccination, so 0.3 ml of the Pfizer BioNTech can be given, and 0.25 ml of Moderna can be given, or 0.5 ml of the Johnson and Johnson at least 2 months can be given. For the group of 12 to 17 years, 0.3 ml of Pfizer BioNTech at least 5 months of the primary series can be given. And then here for the age group of 5 to 11 years, no boosters are recommended. So all the drugs produce the beneficial effects, but there are some adverse drug reactions that is called as a reactogenicity. So vaccines also, they have the adverse drug reactions, and in order to monitor the vaccines, so the vaccine adverse event reporting system has been developed. And then we have this severe allergic reactions, anaphylaxis. So this is a rare and severe type of the allergic reaction. And then in the corona patient also, he dies with a blood clot leading to the thrombosis and then thrombocytopenia syndrome. So it is a rare and severe adverse reactions. Here the low platelet count and blood clots will be there in the large blood vessels. And then cautiously skeptical about direct link. So it is a neurological disorder. It is otherwise called as a Guillain-Barré syndrome. It is a rare disease that affects the nervous system, muscle weakness, and the paralysis. So, and then we have COVID also developed the heart even in asymptomatic patients, that is a myocarditis, pericarditis. So myocarditis is the inflammation of the heart muscle, and the pericarditis is the inflammation of the heart's lining. So the rare cases are seen in patients at the age of 30. Myocarditis is the inflammation of the heart vessel, and pericarditis is the inflammation of the outer lining of the heart. Well responded to the treatment. It can be well responded to the treatment and quick recovery. So the reports of the reports of death after COVID-19 vaccines are rare. So nearly 11,408 deaths out of 529 million doses of COVID vaccines has been reported. Out of this, that is 0.002% has been reported, and 85% of the deaths have occurred due to the unvaccination. Current therapies in clinical practice, we have the monoclonal antibodies, antiviral drugs, and interleukin inhibitors and anti-inflammatory drugs are used for the current therapies. So biomedical wastage of COVID-19, the biomedical wastage of unused medicine, unused foods, medical supplies, and all the belongings of COVID-19 patients and medical supplies of the healthcare workers, including the dead bodies, must be put on fire by incineration. So conclusion, the COVID-19 vaccines are safe and effective and appropriate. So the Center Disease of Communication, it recommends everyone ages 5 years and older get vaccinated as soon as possible to protect against the COVID-19 and its potentially severe complications. CDC also updated its recommendation for COVID-19 vaccines with the preference for mRNA vaccines, that is Pfizer, BioNTech, and Moderna, and millions of people, they have received COVID-19 vaccines under the most intense safety monitoring program in throughout the globe. And then PVPA and WHO and the CDC and US Food, Drug and Administration and other federal agencies, they continue to monitor the safety of the COVID-19 vaccines. So the vaccines, they are antigens, and its primary series of COVID-19 vaccines show prophylactic as well as a therapeutic outcome. They boost the immunity in patients, and its coverage is extended by booster to reduce the morbidity as well as the mortality. So I am very thankful to the ACPI members, that is Professor Anand Nayak Nagappa, Sir, National President ACPI, and Professor Dr. N. Udupa, Executive Director, and Dr. Hanumantachari Joshi, President ACPI, and Dr. B. Pavan Kumar Sir, Vice President ACPI, and Dr. KSG Arul Kumaran Sir, Secretary, and Dr. V. Gopal Sir, President ACPI Tamil Nadu, and Dr. Gampa Vijay Kumar Sir, Management and Staff, Sarada Vilas College and KGR Institute of Technology and Management, for giving me the opportunity to deliver a talk in this COVID-19 sequel series. I would like to extend my thanks to our chairman, Base Group of Institution, Dr. Aisari Ganesh Sir, and my director, School of Pharmaceutical Sciences, Dr. P. Shanmugasundaram sir, and Professor and Head of Pharmaceutics, Dr. S. Satish Kumar sir, and HODs of various departments, and my beloved faculty members of School of Pharmaceutical Sciences with VISTAS, who always constantly support me in all my activities. Thank you one and all. Thank you so much.
That was a wonderful talk, madam. Thank you so much for the excellent talk.
Thank you, sir.
Ranjita, are you there? Ranjita, madam. Hello. Yeah, sure. I'll do that. So before Ms. Ranjita comes in, see, every time ACPI gives, a best delegate award. If anyone has asked a good question which can be identified, the award can be given. Yeah, now you are the co-host, Ranjita.
Yes, sir. Yes. Thank you, ma'am. It was a very informative session. Now it's time to ask questions to our speaker. Any questions from the delegates?
I think there is a question by Sudipta that you can read.
Hello. Good afternoon, sir.
Yeah, go ahead.
Sir, good afternoon, sir.
Yeah, please go ahead.
Sir, in COVID time, the remdesivir injection is must and like that. All hospitals, sir, first start supply. The people also are so very horrible in here and there. In state level also, they are roaming and coming. Now it is, there are no question upon the remdesivir. How it is, sir? So, okay. Hello.
Yeah. Gopinath sir, can you please answer that?
Oh, okay. Actually, it is a tricky question. Actually,
yes, sir.
At the early stage of COVID-19. Okay,
yeah.
When the remdesivir is given in animal models.
Okay, sir.
There is a good improvement. There is no replication of the virus. It is acting as a antiviral drug.
Okay.
So thinking that they applied even in human beings. So when this remdesivir is given at the early stage, there is a good recovery so that the stay of the patient in a hospital can be minimized or reduced.
Okay.
So there is a wonderful outcome in the patient.
Okay.
When the remdesivir is given more than 5 days or 7 days, the recovery rate may not be good. So the stage of giving injection will give you a good impact on health development or recovery of the patient.
Okay, sir. Okay.
It's a wonderful medicine.
Okay. But nowadays also it's that is only for good answer.
No. The thing is there is a ambiguity. Actually, there is a mixed results are there. For example, see, it depends upon how the patient is responding towards the medicine.
Okay.
Okay, so people are responding good for some medicine, some people are not responding to the medicine. But as the evidences, our practice-based medicine says, when the remdesivir is given in COVID-19 patients at the early stage, so that you can reduce the stay of patient in a hospital. Okay.
Okay, sir. In chronic, sir, another one, please. In chronic pulmonary disease or chronic, what you call pneumonia cases, it is good for or anything, sir? It is reaction.
Which one? Remdesivir?
Remdesivir, yeah, remdesivir. Remdesivir in chronic pulmonary.
No. The drug is meant for systemic use.
Yeah, that's why I asked.
Okay, it is a systemic use. It is not organ specified drug.
Okay.
We are going to target the virus, not the body.
Oh, right. Okay.
Okay. Once, if you are going to target the virus, if it is going to be removed from the body, automatically the body will come to the normal.
Okay, sir. Okay.
But what is the success rate? We had to go for that. There is less evidences. Initially, they
Yes.
said that there is a good outcome from remdesivir. There is a mixed result thereafter. Are you hear me?
Yes, sir. Yes, sir.
Okay.
Hearing. So audio.
Okay, sir. Thank you so much. Are you happy
Okay,
with my answer?
Yes, sir. Sir, your good name, please. My name is
Myself,
Mr. Dr. Ravi in Tamil
myself,
Nadu.
Ravi,
Gopan,
sir.
sir?
Okay, myself, Gopinath, sir.
Gopinath, sir. Okay,
Yes.
from, sir? From?
From Andhra Pradesh. I'm working in Andhra Pradesh. I am the student of Madras Medical College and
Super,
JSS
sir.
Ooty. JSS Ooty.
Sir, which year, sir? I am also JSS
long back, sir.
80, sir, first batch myself. 83,
Okay,
82,
fine.
83.
I am a graduate at the time. No, 92, 88 to 92, my graduation from Madras Medical College. Later on,
He is also an advisor
JSS.
of ACPI South India. He advises us on all our activities.
Very nice to talk with you, sir.
My name
Thank
is
you so much.
Dr. Ravi, sir. M. Ravi. I also
Very
JSS
nice.
student. I am very proud of you, sir.
Thank you so much, sir. I too
Thank you,
very
sir.
proud of JSS.
Okay, thank you, sir.
Yeah, thank you. There are no other questions, it seems, Ranjita.
Okay,
There
sir.
is one question from Sudipta Roy. Can you shoot that question to Dr. AkilaDevi, if she is there?
Hi, sir. Sure.
Otherwise, Sudipta is there online. So you can ask the question directly, Ms. Sudipta. You can switch on your video also, Sudipta.
Sir, actually, I have some problems, sir, in video.
Fine, go ahead. You can ask your question.
Sir, I was asking about that. We know technical knowledge about the pharmacy and the other medicinal terms, but when the patients have been suffering from COVID and after that they have been dying, so what can be the social role for pharmacist, individual pharmacist into their particular area to the patient? Then they can save the life of a patient. So this is my question.
I think Gopinath sir can answer.
Madam, can you repeat the question, madam?
Sir, it is typed in the chat box.
Yeah.
Is it in the
Yes,
chat
sir.
box?
Same question, sir. Yes, sir. Chat box question and my question is the same question.
Yeah, you can repeat it.
Sir,
Can you simplify the question?
this, sir, I'm saying that we have knowledge about the medicine and the medicine regarding the COVID-19 patient and other symptomatic symptom related medicine also. But after suffering from COVID-19, mostly patients have been dying of COVID-19. So how it can be preventable measure or anything other measure or any other role by a pharmacist, by individual pharmacist in our society?
Okay.
Because we are pharmacists, we are working to a hospital or any other, but still COVID-19 and they are taking the medicine and they are taking the precautions and still they are dying. So can it be any plan to the society to save the patient? So I'm just asking this. Is there any role of pharmacist to make any plan to save the patients from dying? Because we have invented vaccine, we have invented medicine, and we are giving the medicine to the patient also. But till patients have been dying of COVID-19, we can see the cases. The patient dying from COVID-19 is increasing, and is very much important factor to save the patients at this moment after giving lots of medicine and medications also. So sir, I'm just asking that is there any plan to the pharmacist that pharmacist can play a vital role to save the patients?
Okay, thank you, madam. Thank you. Actually, when people are affected with COVID-19, so there will be a consequential effect will be there. It will damage almost all parts of the body. It depends upon the severity of the condition of the patient. So as far as the pharmacy is concerned, generally for the recovery of the patient, when we are going to focus on the recovery, especially you can go for giving supplementations, vitamins, healthy diet recommendations, rehabilitation process techniques. If you teach them so that there is a quick recovery from the disease so that we can minimize the death.
Yes, sir. But still, sir, up to the patients have been dying, sir.
Yeah, it is true. COVID is such a pandemic situation, such a severe condition. It depends upon so many factors. Age factors is there, comorbidity is there. See, for example, I will tell you one example. When we are going for chest imaging, if the patient is having severe lung disorder, okay, HRCT, if it is having a score of more than 18 or 20, 22, see, when the lung is divided into 25 parts, if there is a damage of 22 parts, is it possible to get the patient back? No, it is highly impossible. Highly impossible. It is irreversible damage.
Yes, sir.
Sonika madam, you are asking the question?
Yes, sir. Yes, sir.
Sir, very. Okay, how are you, madam? How are you, madam? Your voice is not audible to me.
Sir, I'm fine, sir.
Fine. See, actually, one can go for giving supplementation. It depends upon the severity of the patient. If it is a mild or moderate, you can bring back to normal. If it is a severe condition, it depends upon how he is going to come back with the virus.
Yes, sir.
What is the level of organ damage happened? There are so many other factors. So for that, I said even rehabilitation process, rehabilitation, even in healthy individuals, that helps every citizen. Pranayama, yoga, all these things really help for the patients besides medications.
Yes, sir.
See, most of the COVID patients.
Sir, for this reason, I was asking that is there any simple preventive measure then we can give to the general people that they can be they can save their life also. That pharmacist will
vaccination, promoting vaccination. That is the simplest way. Personal hygiene, social distancing, all these factors will play a role.
Yes, sir.
How to avoid the cross contamination? That is the biggest. That play an important role.
Yes, sir. Everything is, sir, we give the everything, a simple thing we give to the public, and still public have been suffering from COVID-19. We are giving the vaccination, we are giving the process and awareness to maintain the sanitation and hygiene, and still the public have been suffering from COVID-19, and they are getting, they're losing their lives. Sir, is there so okay, sir, thank you, sir. Actually,
are you happy
I would
with
like
the answer? Are you happy with the answer? Are you expecting much more on that?
Because I'm pharmacist, for this reason I'm convinced. But I have seen the people have been suffering from COVID-19 and they are taking the simple measure and still they are getting a recovery. And after that, they have been dying from the COVID-19. And lots of people, they may be more than 50 years old, they may be 20 years old, 30 years old. And for this reason, I was anxious about that. We know
I can.
know
Yes, I
the
can
simple
understand you.
the pranayam, yoga, rehabilitation, and everything. But till we cannot save the life of people of our country.
Yes,
this is
madam.
true.
Yes,
There are
madam.
lots of challenges.
Managing a patient is not a simple job.
Yes, sir. Yes.
It all depends upon the severity of the condition.
We want
Severity of the
pharmacists
patient.
to give us any apps or any kinds of applications or any kinds of role to the community that it must be necessary that we have to play a role to our society other than our working time. Then it may be helpful.
Yeah, I can understand what you are saying. See,
Yes, sir, yes.
repeatedly I am saying that it depends on the severity of the patient. How he is going to fight with the COVID vaccine. Even sequential effect, how we are going to minimize it.
Yes, sir, yes, sir.
Okay. See, otherwise you have to go for medical interventions.
Yes, sir.
Unless otherwise, if you don't have medical intervention, it is very difficult to manage the patient just with the medications.
Yes, sir. Even we cannot.
You can boost the health of a patient by giving supplements, minerals, dietary changes, calculated dietary, and other factors. You can suggest the patient for the right place also for further evaluation and treatment. That is only the thing a pharmacist can do.
Yes, sir.
Hello, good afternoon, sir.
Yeah, good afternoon. Your voice is coming a little slowly. And I also welcome Dr. Giriraj Kulkarni, who is an active researcher and a very good supporter of ACPI. Welcome to you, Kulkarni, sir.
Thank you, sir.
Ranjita, madam, can we proceed with the next step?
Sure, sir. Now I request Sonika Mallika ma'am to hand over the certificates to our today's speakers. I request Sonika Mallika ma'am to hand over today's certificate to Dr. Akila ma'am. Please, ma'am.
Congratulations, ma'am.
Thank you, ma'am. Now I request Mr. Giriraj Kulkarni sir to hand over today's participation test certificate to Gopinath sir. Please, sir.
Thank you. Dr. Gopinath sir, your certificate. Thank you for your presence and enlightening speech. It was really interesting, and I am really happy to know that you are a JSS person, because I am also a alumni of JSS. I worked in JSS and I did my PhD there.
Great. Thank you so
Thank
much,
you, sir.
Thank you so much for getting the certificate through your hands.
Thank you, sir.
Thank you, sir. Now I request Sonika Mallika ma'am to hand over the certificate to Ruby Raphel ma'am.
Congratulations. Congratulations, Ruby ma'am. It is always a pleasure to be a part of all this, and to add, the role of pharmacist has always been disease and medication management. So that is what we can do. We are helpful in disease management and patient management and medication management. And that is what we are doing since ages, and we will be doing in further. But yes, clinical pharmacy has improved a lot, and Joshi sir always makes it a point to enlighten all of us with all of his, some of his these community pharmacy webinars and all. So I have been vaccinating, and truly COVID is still in a process. We still don't know. All of us don't know where it will take us. Even vaccination, after a few years, we'll know what is going on. So it is a challenge we all have to accept. It's going on.
Thank you, ma'am. Thank you so much. And today's best delegate award of this national webinar goes to Sudipta Roy. I request Mr. Gopinathan sir to hand over this best delegate award. Sir, please, sir. I request Sudipta Roy to accept this best delegate award.
Thank you, ma'am.
Hello, congratulations, Mr. Sudipta Roy, for the best.
Miss Roy, sir.
Miss Roy.
What is that?
She is Miss Sudipta Roy. So congratulations,
Oh,
Miss
sorry,
Sudipta.
I am really sorry, madam. Congratulations.
Yes, sir. Actually, I
For the
was
best
worried about
person.
people, sir, very much because they are not, they do not have money and they are suffering from economic, and how they will manage all such kinds of things other than free medications. That's why I was asking that how to serve the people, because if you're going for Delhi metro city now, then you can see the people have been taking their they are residing in a very slum areas, and the people mostly come from the rural areas for their survival. They are working in different kinds of street food sellers and different kinds of habitats they have. So how we can save these people? They are basically below economy. Below economy, they don't even afford the medicine, vitamin C even. So, sir, for this reason, I was asking
But after all these concerns only have been selected as the best delegate. Congratulations to you, Ms. Sudipta. I think we can move on to the next step, Ranjita.
Yes, sir. Thank you.
Thank you. Thank you. Now I request Dr. Gampa Vijay Kumar, Principal, Department of Pharmacy, KGR Institute of Technology and Management, Hyderabad, to close these remarks. So please, sir.
Vijay Kumar Garu, it's your turn, sir.
Yeah, thank you for the opportunity to propose closing remarks on this national webinar. My dear gurus and dear friends, distinguished participants, ladies and gentlemen, and friends of ACPI. I'm pleased to thank you for joining this webinar on role of community pharmacists in post-COVID-19 Sequele. Let me wrap up by saying we can do miracles in the community pharmacist sector, and it has proven in this recent pandemic situation. We will need to innovate in patient community, patient safety, patient explanation, counseling, particularly with respect to the adverse reaction effect and the ADR report and the patient safety, patient drug monitoring, and then all these things we will need to re-engage and build trust across the world, not only in India, respective community pharmacy sector. And then I look forward to your help, your support, and your ideas to lead our pharmacy sector, particularly community pharmacy sector, to lead globally. And then in the end, I want to thank ACPI and also particularly Joshi sir, and then my dear friend Giriraj Kulkarni, Gopinath, and Ruby Raphel, and AkilaDevi. All these things I want to thank. And then the help which I received from the Joshi sir, and then regarding his support, because of this is the session we are organizing in association with the Mike Institution also, KGR Institute of Technology and Management. And then he helped me a lot, particularly with this session. I thank you one and all. Thank you.
Thank you, sir. Once again, I thank one and all for making this webinar successful. Thank you, one and all. Have a good day.
Thank you, Joshi sir. Thank you for giving this opportunity.
Yeah, thank you, Gopinath sir, and thanks to Giriraj Kulkarni sir for your time.
Thank you, sir. Thank you so much, Kulkarni sir.
Yeah.
Sir, can you?
Joshi sir and Giriraj Kulkarni garu for this delegate participation certificate I have already posted, and then moreover I will post your particular message. Actually today already 100 is exhausted, and then tomorrow morning I can reissue the certificate.
Sir, Govinath sir, your number please.
I will.
So
89789.
Sir, wait. 89
789
89789
9381.